Good evening, everybody. My name is Jeff Ashby. Welcome to another incredible, terrific Tuesday here where we get to talk about the optimal longevity of our bodies. And we're here so excited to have Jet and Dr. Court as they host this call with the world's foremost expert on micronutrition and supplementation, Dr. Kedar Prasad. But before we get underway, I just want to say thank you, everybody, for being here. Please get back with the individual who provided this link for you, get your questions answered, and just lean into tonight's educational opportunity. As we do that, I'm going to pull up the disclaimer. It's important that we protect ourselves legally, so follow along with me as I pull these words up onto the screen. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes information on recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider. So that having been stated, we are free to continue on. It's my pleasure to invite some wonderful friends forward as they host tonight's Optimal Longevity series. And here we go with Jonette and Dr. Court. Great to have you guys here tonight.
Great to be here.
Thank you, Jeff.
Take it away.
All right. Why don't you go ahead and we'll get Dr. Prasad spotlighted. Would you mind introducing him? And I'll pull up his accolades for you.
Thank you.
Here we go.
Sure. We want to make sure that we always welcome Dr. Prasad because, you know, he is a living legend.
Ooh.
And we are so grateful to be in his presence. Dr. Prasad was a professor at the University of Colorado School of Medicine for more than 30 years. He was the director of vitamin and cancer research. He's also the former president of the International Society of Cancer and Nutrition, London.
No.
Whoops.
That's the next one.
And a member of the British Society of Medicine, London. He was asked personally to sit on the Nobel Prize nominating committee for candidates in medicine.
In 1982.
In 1982. And he is the world's first PhD radiation biologist. He was also personally awarded 7 U.S. patents on micronutrients. He discovered the anti-cancer potency of vitamin E succinate, and he also discovered butyric acid and the anti-cancer agents of that. He is an author of more than 32 books and author or co-author, and he has published more than 250 peer-reviewed articles, as well as being listed in PubMed more than 450 times.
And published in very prestigious journals such as Nature,
Gemma,
and Science. He's been published in very prestigious journals. Welcome, Dr. Prasad.
Welcome.
Thank you, Jeanette. Thank you, Dr. Court. It is always my pleasure to be with you and your friends and our engaged family members. I always enjoy it.
Well, I wanted just to recap from last week. We talked a little bit about Parkinson's, and I want you to know we felt it was one of the best calls ever, and that we really walk people through that you are an expert of neurodegenerative diseases, but in particular Parkinson's. And it was an amazing call. And tonight I wanted to segue into another topic, maybe not as popular as dementia or Alzheimer's, but one that he is really truly an expert of, which is TBI, traumatic brain injury and concussions, which was really Dr. Court's area of work. And then how we brought in, your product line to him because he used to x-ray, and he used your product to protect his patients that were concussed with your Micro Daily original product. And so we're gonna segue to that topic tonight. And I did dig up, just so you know, some of your work and patents on that topic. So that was fun. And I'm like, wow, this is amazing to get to see this work. But before we do that, why don't we just go ahead and explain why we do this call and I'll pull up the graphic, which I think is important. Let me see, it is right here. All right. And there are a lot of people out there talking about optimal longevity and many different physicians. And what I love about Dr. Prasad's work is he is in alignment with this definition, which is your lifespan is how long you live, and your health span is how many years you live a healthy, vibrant life. And you want your health span to equal your lifespan. And that's the bottom part of this graphic. And I want you to know that Dr. Prasad, we've learned, right, that he was actively playing tennis and volleyball up until in his 70s, and a very active person, and doing what he loves, and still writing peer-reviewed papers and textbooks that are coming out on diabetes, that he's still learning and actively using this every day. So, you know,
I think the story that I like the most, Dr. Prasad, tell us again what your wife said when you were still playing. Was it volleyball or was it tennis?
It was
and you
tennis.
were beating the youngsters.
Said,
tennis.
Yeah, don't you feel ashamed that you are playing against 20-year-old kid? So I said, no, because I'm beating them, so I'm happy. So
I love that.
You know what? Those are the stories, and it's about being in alignment. And so with that, we want to segue and really focus on our work is really, we study the science of how we heal. And that is the second book of medicine. And that actually the work that Dr. Prasad's been working on for many years, the multi-micronutrient approach. And so the three components that we use for the healing cycle are nutrients, wakeful activities like the stuff we were doing today in the NeuroDig, and then restorative sleep. But the number one hallmark of aging, which we've discussed before, is dysfunctional nutrient sensing. That could be blood sugar, insulin resistance, energy like mTOR or AMPK, the inability for the body to sense those nutrients. And so Dr. Prasad's work is so important because he has 24 million in research on just one product. And I want to segue to when you first started using the product, and your work was really focused on concussion.
Well, you know, and I was just thinking about this while you were bringing this up, Jonah, and that is that, you know, when we look at optimal life, optimal aging, we have to look at what's happened to us in our life, our exposome. And so many of us, like myself, I started ski racing at 7, had my first major concussion at 7, and then actually got labeled learning disabled because of a brain injury that I had. But I didn't have one concussion in my racing career. I had 6 over the course when I had to finally retire because I couldn't do it at that level any longer. But we look at like soccer players, for instance, and every time you take a soccer ball off your skull, the brain shifts and moves. And depending on how you take that soccer ball off your head, or depending on how you get in this concussion, get the concussion, your brain can actually pivot. And if the brain pivots, it causes, because when the brain hits the skull, it doesn't just hit it flat, it hits and pivots. So depending on how hard you stop, it has detrimental effects. And we repair, we heal. But unless we work on all the systems, then we can heal kind of skewed, just a little off. And it's not until we get older when that skew becomes a major problem.
Well, that's fascinating, but I wanted to talk about, can you get a concussion if you just don't hit your head? Like, let's say you fell really hard on your rear end, like on the ice, but you didn't, hang on, but you didn't hit your head. Could you still be, in your opinion, concussed?
Yeah.
Okay.
Yeah, I mean, my office was above a hockey rink, and I saw figure skaters and hockey players landing on their bottoms really hard, and that energy, that force still goes up and affects the back of the brain, which then affects vision. It affects balance. It affects other sensory components. So a lot of these kids can lose actually their sense of smell, and they don't realize it. That's a really common condition.
And like car accidents, even if it's a little bit of a fender bender, it doesn't have to be a super hard one.
Sure.
And this is his work. So people would come in, but let's pull up what is a concussion. So I did a little easy graphic, and then we're going to look at Dr. Prasad's work. It is so fun to get to pull this stuff up.
I love the concussion study he has.
I know.
It's my favorite.
I know. We're going to get to it too. But what is a concussion? Dr. Court, why don't you walk us through some of these symptoms? Can everybody see that okay? Dr. Prasad, can you see that?
Yes.
Okay. Why don't you walk through some of those symptoms for people?
Well, I like to call a concussion a high-speed stop. And with that, like in my concussion when I was 7, I had neck pain. I had a headache. I really couldn't see the TV very well, so I was sitting close to the TV. But the common symptoms, most common symptoms, are headache, balance problems, and lightheadedness, double vision, blurry vision, or like I said, I had a hard time processing the television, sensitivity to light and to sound, change in our sleep patterns. So in my first concussion, my sleep pattern switched. I was up all night and could hardly function during the day.
Nauseousness.
Yeah, oftentimes with concussions, we end up quite nauseous because our stomach goes into a completely different system, and we have problems with digestion, and you're in a sense of shock. So
ringing in the ears.
Huh?
Yeah,
ringing in the ears or tinnitus.
Feeling tired.
Yep.
And drowsy.
Right.
Sleep patterns, depression.
And rage as well.
Yeah, down here it said SNAP. It said being irritable, right? And then also feeling not just right.
I like to call that ugly mood swings.
Okay.
Yeah.
So
you never know what you're going to get, you know?
So it could be even a little tap. But for people on here, if a child, got in a bicycle accident, even they fell outside, even it didn't seem like much, those are some symptoms to be looking for.
We know when you look at like children too, we call them toddlers for a reason. So they got a big noggin and a little body, and they lead with their head. How many times have you seen a little kid just land and go right on their noggin? So, I mean, we can have injuries to our brain and to our function, even as a toddler. And then, like you were saying, in car wrecks, I think the worst car wrecks that I ever took care of was somebody that hit a vehicle or got rear-ended and then hit the vehicle in front of them. Mm-hmm. Because the damage from the rear ending damaged the lower cervical spine and the ligaments in the front and the back of the neck. And so then when they hit the car in front of them, they didn't have anything to stabilize their neck. So then their head snapped and they injured the skull, the spine at the base of the skull. So, I mean, we don't have to do a show of hands, but I know it's happened to a few of you.
So how important 8 years ago when I brought this micronutrient to you and you used to x-ray, you were a very upper cervical specialist. How important is this product to protect your patients? Because they're already concussed. They already have, all of these symptoms. How important was that?
It was such a gift because, and I didn't really realize what a gift it was until Dr. Prasad and I started talking about the radiation and the concussion studies that he did, which we'll go into that a little bit, hopefully here in this talk. But when I realized what I had, a product that could decrease inflammation and oxidative stress at the same time, which is such a big part of concussion, as well as protect them from the necessary x-rays that I had to take, there was, as you know, I went into the cabinets and started looking at what I had. And a lot of things I just threw away because I wasn't going to put it in people's bodies anymore.
Right.
Yeah.
So why don't we go and talk about Dr. Prasad's, let me see. Let's talk about Dr. Prasad's concussion study. Dr. Prasad.
Yeah, it's very important. Like you mentioned, there was some recent information came out that even young kid, like you were mentioning, a high school kid playing sports, for example, and then after that they leave or don't play anymore. But when they die, they did an autopsy and they found that brain was severely damaged. And of course, like football player and other type of player, it is well known that their brain get messed up because of this concussive injury. Like you mentioned, Dr. Court, when the brain shakes it, and that create all kind of issues. Minor blood vessel can broken, and then create oxidative stress. And
well, so, Dr. Prasad, the injury in our football, the front lineman.
Yes.
We usually think it's the guy that jumps up and catches the ball and gets creamed.
Yeah.
He doesn't get creamed on every single play.
I know.
It's the front line
so,
that every time they hit, they're having
not only have increased risk. There's all kind of neurological issue at the autopsy, but in behavior-wise, they are exhibiting all kind of, like you mentioned, and sleep problems. So the quality of life becomes very poor. So the question is, the first study with this at that time, my approach was one approach like micronutrient. But of course, now we have a combination of approach. For the first time, anybody have suggested that for any human illness, whether it's a concussive injury or some other kind of things, you have to have a multiple approach, and micronutrient is one of the major component there. But anyway, so to study this in the veterans returning from war in Afghanistan and Iraq, and when they suffer concussive injury, they are sent back, and they first go to Germany for treatment. So by the time they come to Naval Medical Center in San Diego, the time interval is between 3 months by the time they get exposed, and by the time they come to 3 months exposure. And so Captain Hopper was the Navy captain at the time. And I met him and I said, here we just finished the study with a health research center at the San Diego, basic on Marine Corps in training. And we had a very good result of reducing oxidative stress. And so he said, yeah, I would be interested. So then we got an IRB approval and I started the study. And these people had symptoms, like you mentioned, dizziness, because they can measure quantitatively dizziness, and balancing problem, because they can measure. So they picked up these two criteria. But I'm sure they are suffering other criteria that you mentioned, Dr. Cote. But for research purpose, you have to have what you can measure quantitatively. So he measured it. And in a military, you have to have a standard care that they have been getting all the time. So one group got a standard care, another group with a standard class plus MMF at the time, because we just finished testing in Marine Corps. And the study was 12 weeks. So after 1 week, nurse was saying that to Dr. Hoffer, that I don't know, some people are showing little better results, but it was all blinded. So nurse doesn't know who is getting what. But anytime she has observations, and then she will report to him. And turned out that after 12 weeks of a study, when they opened the code, they found that the combination group, which has both a standard therapy plus MMF military micronutrient formulation, did much better in all the measurements that they did. And I was surprised, even though I thought that he might be useful, but until you get the results. And Dr. Hopper presented this work at the International Meeting of Audiology in Europe someplace. And so that was the first study of and as you know, these veterans, 40% of them, if you are not treated, they will develop PTSD, which is the worst form. So it is very, and it is also occurs in civilian, like in many conditions, you fall or this. It is not the military issue, but it's much more acute in military than in civilian. But civilian, like a sports, is as bad as military. And so it is very, very important to do how we can prevent it while it is happening, not after. It is also useful after it happened, and still you can get benefit. But the question is, if you give a micronutrient supplement before the kids goes to play soccer, high school kid, or at any age, any kind of sports, it is better to protect yourself, because during that time, not only you have this physical problem of shaking the head when you hit your soccer or our football or any kind of, when the brain shakes very heavily, it damages. But also, you use a lot of oxygen. Therefore, you are generating a lot of free radicals. And brain is already producing naturally a lot of free radicals because they are using a lot of oxygen. And so on the top of that, you add additional. And can you believe that if you don't add anything, your own endogenous has only certain limitation. You can reduce, if you are young, if you don't have high level of oxidative stress, this will reduce it, but not while you are playing the games, any form of games. So the question is how you can reduce it. Well, if you, before going to the play, you take micronutrients an hour before, say, for example, and then after finishing the game, you take another dose of micronutrient, and then anything that will happen, it will be very minimal because you protected your brain, you protected your body as well. But more important is brain, because brain is not only is producing a lot of free radicals, but it has the least amount of antioxidant. And therefore, it is our job, once we know what is happening, to provide the additional micronutrient. And so at least for prevention point of view right now, if you are young, I think, for example, micronutrient that we have, EMF, either hydro or capsule, whatever you prefer, take it. And at that time, there is no intestinal dysbiosis at the time. There is no intestinal dysbiosis. But second important thing that you have, that they can have it, could have impact as well, is omega-3 fatty acids. Mm-hmm. Because, we don't get a DHA and EPA sufficient amount from our diet if you are vegetarian or even non-vegetarian until you eat fish. And so the second most important thing would be for the kids, high school and other things, you take a micro daily and take the EMF, and also depending upon the age, and also take the omega-3 daily that we have it. And but if you have already some kind of disease, like you were diagnosing already expressing the symptoms of concussive injury or traumatic brain injury, and then you have to also have a probiotics is a must. And if you are older, also collagen peptide is a must. And so one can devise a multiple approaches depending upon the age and your health condition. But since we have already seen the positive result, even a tinnitus, you mentioned it, even the symptom of tinnitus is markedly reduced, because one audiologist, I told you in Nashville, she did a study on a veterans who are showing the very extreme level of a tinnitus, and they found she didn't have placebo control, but whatever level of intensity was there, she was measuring quantitatively. Before she put on the supplements, she has record, and then she followed for 6 months, and then keep measuring in between. And at the end of 6 months, she found that there was a dramatic improvement in over 70% of the people. This and so it is.
Dr. Prasad.
So then even hearing disorders can be dramatically reduced. Tinnitus is one of the symptoms of hearing disorder, but age-related hearing problem is also occur without traumatic brain injury. So under all these kind of conditions, it is very important, not only for prevention point of view, then you do one strategy. Once you have already suffering from health issue, then this is a different approach. I'd be glad to answer question, anything, but this is what the my approach right has been. And
the brain
that we have changed a strategy. Remember that before that, even you have to have a single nutrient before you get funded from NIH. Then finally, after 10 years, somebody said, no, I think so. They started funding now multiple micronutrients. But it is single approach. Nobody has proposed this idea that for a disease, you have to have multiple approach, which involves micronutrient, how to reverse intestinal dysbiosis, omega-3 fatty acid, provide a sufficient amount of DHA to the brain, because brain, as you know, 40% of the fatty acid in the brain is DHA. And if you are just a vegetarian diet, you have a alpha ALA, which converts very slowly and minimally to DHA. So it is okay to have some their result, but it is better to have that we have proposed omega-3, and then of course collagen peptides. And so now we have approach for any disease, depending upon your age. We have not one approach like we used to have initially micronutrient, but we have multiple approach that we are the first one to propose that.
And I want to go back to really your work when I'm explaining to a lot of the physicians, they look at research and they're all single antioxidants or single nutrient. And your approach, which has many peer-reviewed works, we're going to look at a couple right now, is a multiple micronutrient approach. But now you also have a multiple omega approach.
It's
not one. And so instead of a lot of the practitioners are throwing high EPA because they're inflamed, or high DHA.
Just one agent. One approach.
Right? And they're not addressing even the GLA, which is really important. But why don't we pull up a couple of your studies that you did on TBI and concussion? So we're gonna, let me see if I can get those up. When we lost you, I don't know if looks like I can't get it. So we're gonna stop share. When we dropped off, I had a couple pulled up, but Dr. Prasad wrote a paper. The first one that I found was in 2014, and it was about NRF2 and TBI. And so if you want to Google this, that was that first paper in 2014. And then he had a second paper on traumatic brain injury and symptoms and with Bondi in 2015. And so there are two papers that he wrote on those. I'm sorry that they fell off the screen, you guys, as we dropped off. But then he also has a book on TBI for traumatic brain injury and concussion. You can do, but textbooks that Dr. Prasad wrote, which is very detailed. So if you're a practitioner or you work with people, I mean, this is really something you need to be able to go to that chapter and really look at traumatic brain injury and concussive blasts and be able to look at his strategies, which he did recommend an omega-3. But I also looked up separate from your many patents that you already have patented and patent pending, but you also had one that was co-patented in 2014 for the micronutrient formulation for concussive head injuries. It's not listed in our list of patents that Dr. Prasad has been a part of. In 2014, he has a specific patent on this formulation for concussive head injuries. So in that, he included omega-3.
At that time, but it was not as strongly application, but when included, this will be useful. And so now we have a product, and the best product in the marketplace.
And a strategy, your multi-micronutrient strategy, including the omega-3, which I think is going to be, like when I walk through that, I'm like, I'm sorry that I didn't get to show you like walking through like last week, and it's fascinating as a researcher going, wow, he laid this foundation years ago, right? And then more information came out. And now we actually have a suite of products that, you can be able to use to share.
I think it's important that you look at, when we look at a TBI, a traumatic brain injury, or a concussion, same thing, but there are various kinds of concussion. And when we look at our product suite, we have EMF Hydro, which is easily absorbed, quickly absorbed, has profound effects very quickly. Then we have the new Omega product, which is also incredibly important. In addition to that, when the brain is injured, the gut goes into
bad shape.
So then the probiotic is essential for us to have. Not only that, then we also have issues with our vision, oftentimes, depending on where the brain is injured. And so we have the eye boost as part of our product suite. And not to forget that the whole reason that we're taking these nutrients with the TBI is that we have a brain injury.
Exactly.
So, Dr. Prasad, can you just touch quickly the brain boost? Importance of the brain boost and the eye boost, and then the CBD. Because one of the big things is the loss of a coping mechanism when your brain is injured or your brain is on fire.
Like you have a disturbance, sleep disturbance, anxiety, depression, like you mentioned.
So tell us a little bit about why the eye boost is so important when we have an injury to our brain.
Yeah, because brain, as you know, that eye's nervous system is also communicate with the brain. And so when I was developing it and doing research on this issue, as you know, human has a two pigment, zeaxanthin and lutein. Excuse me. But so most of the clinical study which was performed in a macular degeneration and other diseases and found some benefit was only two pigment. So I was thinking that, well, how I can make them unique that is more useful. And so I came across a paper that shows that eagle can see the distance from way up in the sky to the ground, and they will pick up their prey and eat. So they have a very important vision. So I said, what kind of pigment they have? And found out, sure enough, they have a lutein, zeaxanthin, and astaxanthin, additional pigment. So I said, astaxanthin. So I looked the toxicity, what are there? I didn't know anything about astaxanthin. And so, so looking, I found out it is not just the most powerful antioxidant, more powerful than lutein and zeaxanthin, but also it accumulates in the brain in a very high level than any other antioxidant. And as you know, retina part of the brain is highly oxygenated. Mm-hmm. And just like a brain, if you have a highly oxygenated area, it will produce a lot of free radicals. And of course, this will cause damage. So they have certain amount of antioxidant protected, but as you grow older, you don't take a micronutrient supplement, their liver goes down, then you have all kind of eye diseases. And so I said, well, in our preparation, I will add astaxanthin. And therefore, so our product is the only one which has all three, astaxanthin, zeaxanthin, and the lutein. And that's why it is very effective. I told you the story that my wife and my son had a genetics pressure glaucoma. And with all the medications and laser surgery, it remained around 16. My son didn't have surgery, he just has a high ocular pressure, eye pressure. And so after 3 months of these things, she went to the doctor again, it came to 13 and 14. And my son, which used to have like in 20s, it came like a 16, 17. So it was very important. So I think it is going to be much more important than you realize. And then, and of course, I've added some vitamin E and C just to stabilize it so they don't get oxidized and destroyed. Yeah.
Dr. Court is loving the omega-3 with this. It is actually affecting his slight cataract, and he doesn't have to wear his glasses as often to read. And I want you to know that this is we've tried lots of things and lots of different omega-3s, but really the combination of really the foundation product, right, Dr. Prasad, of the Microdaily EMF. But these two together have profoundly the eye boost and the omega-3 for Dr. Court. I mean, each week he's like, I'm not wearing my glasses, and he's reading the same level font. So that's super exciting for everybody on the call. It's just, what do you think?
Well, I think it's really important to actually increase the omega-3 when we're dealing with a brain injury.
Mm-hmm. Yes.
And as you had spoken about in one of our other previous talks, the omega and the CBD both go to the same type of receptors in the brain.
Yeah, the omega-3 also has what you call like a CBD will activate endocannabinoid receptor system, and it will affect directly the receptor for endocannabinoid. It doesn't have to go through anandamide, some other two endogenous one, and CBD will stimulate that one. But this omega-3 fatty acid directly stimulate it. And so you can see that when CBD does by different mechanism, same thing. A combination could be additive effect for example, in reducing sleep disturbances or anxiety, because both affects the for example, serotonin level. If you have decreased serotonin level in your brain, you will suffer anxiety and depression. And CBD does one way, it acts as an inhibitor of serotonin reuptake. And this inhibitor of serotonin uptake is also a prescription drug, which also reduces anxiety and depression, but it also causes side effects, toxicity. CBD does the same thing with no toxicity. And again, it is very important to remember that how all these combinations work together. And of course, endocannabinoid system is more complex action. And so I think, but the combination is very important. And so if somebody wants to have a separate product, for example, for sleeping, no. If you combine these things, and also if you don't have, still you have some sleeping problem, you add 3 milligrams of the melatonin, which is naturally produced in your brain. And so I think, but most of the people with combination, like I do, I sleep very well. Most of the people, CBD is sufficient, but in the event, looks like still somebody has some problem, then you can add a 3 milligrams of melatonin. And so really, these are all combination approach is for your health, is more important. Initially, we started just one approach, multiple micronutrient. But as we evolve, I become more aware of health issue. I'm also a learning process. I mean, I learned as you go along with you guys.
Well, especially the gut. And so we want to talk about the probiotic. And so on this masterfully crafted product, Dr. Prasad did discover butyric acid, which is that short chain fatty acid. But this product, we have building blocks. Most of the tryptophan to make serotonin should be made in our gut microbiome. And if you're taking this product, and your body will be making it, which is called endogenously. So our goal is for our bodies to make it. And so with this product, whether it's the tryptophan, which is missing from the collagen, other than the collagen is almost a complete protein, but it doesn't have tryptophan in it. So if you are having trouble sleeping, the CBD would be a great choice. And let's start working on your gut microbiome. And what's fascinating is tryptophan is the building block to make serotonin, right? To make melatonin. And so the answer is right here.
Much rather have our body make it than try and take a synthetic melatonin.
Exactly. And the one and only way is that if you have a disease, your body is producing opposite. Intestinal dysbiosis, you are producing a toxic chemical in your gut. But as soon as you shift balance in a beneficial bacteria, which will produce tryptophan, neurotransmitter, vitamin B, vitamin K, all good stuff for your health. So it is better to maintain in a good health of intestine, and also allow you better absorption of micronutrient too.
Yes.
Now we can take it and just put a little twist on it, because when we have a brain injury, which leads to gut injury. And that's the importance for the probiotic. But in addition to this, we go back and we look at the EMF formula, and we look at the original military formula, which is to protect us from radiation. So when we have a brain injury, it's extremely important to shut your router off, actually unplug your router at night. It's extremely important to dramatically reduce your time looking at screens, because your eyes are not processing as well. One of the things in a concussion, when we get concussed, is that cranial nerve 3 becomes affected. And that nerve is like in the old camera when we had a shutter. And when the brain gets injured, that shutter opens up and won't close. So it's like looking through binoculars at a Samsung television. It's too much information into the brain. And so that's why the IM formula is so important, but it's also why it's so important to minimize how much time you look at your screens, as well as taking your device and putting it against your brain. So in our clinic, I mean, that was one of the things that I often told the parents, take this away. Don't let the kids be on their computers, their screens, shut the router off and plug the router at night whenever you don't need it, because the body is trying to heal, and
Yes.
it doesn't heal nearly as well when we're exposed to radiation, be it ionizing or non-ionizing.
Yeah, I mean, actually, non-ionizing, like EMF radiation, is become worse than ionizing, because ionizing radiation, only time you get exposed when you have some diagnostic issue, health issue.
Right.
But here, we are exposed daily.
Right.
Even
much
at
of the
nighttime,
research-
if you don't turn off, even nighttime, if you're close to if you keep your cell phone close to your bed,
Right.
So,
Right.
so this is double importance, that you maintain that minimize exposure and take a vitamin supplement like you have been doing all these years.
Dr. Prasad, another thing that when we're talking about brain injuries, and this is something most people don't think about, but you have to look at your sleep environment.
Yeah.
And so in your bedroom, we always suggest that they unplug the lamps that are next to their bed and charge their phone someplace else. But another thing, in some of my severe brain injury patients, we actually have them sleep at the foot of their bed, because all the wires in the house, if they have plugs along the headboard of their bed, that wire, that voltage is going right across the back of their head when they're sleeping. So we have them flip over and sleep at the foot of their bed and put their feet on the wall.
Yeah, that's a good suggestion.
Thank you.
And I think that making a sleep sanctuary for everyone is a great. It needs to be dark.
Yeah.
Be cool. And in order to get restorative sleep, our body has to drop a couple degrees in temperature.
Yeah. And also that, you have to relax a state, in other words, you don't have anxiety or that I don't know what I'm going to do tomorrow. Don't think about tomorrow. And if you think it, you think positive way. Okay, I'm going to run. I'm going to, I'm going to have a nice dinner. Something positive. In other words, most serious cause, not only the pathological causes is of sleep disturbance, like you were mentioning, but also behavior problem that contributes to how your mind is thinking. Are you worried about nothing, or are you worrying about dying? Are you anything worrying about it? Kids' education or whatever. In other words, we can't avoid certain degree, but don't be a chronic one. Acute stress drives you to accomplish your goal, but chronic stress, anxiety, these things have to be reduced. You can go vacation, you can go nice dinner. You have, there are many ways people can relax, but relaxation is extremely important for sleeping purpose. And medical intervention will help you, no question about it. Like we are suggesting it, it is intervention, but also it will double advantage if you can relax, do meditation, do something, close your mind for 10, 15 minutes, not very long. I do every day, 15 minutes.
Grounding, go out when you have a brain injury and walk in the grass.
Yes.
Or like we did today, play in the dirt.
Well, we want to talk a little bit about that, because Dr. Court has a lot of experience personally with concussions, but with patients. But we also have people that have been taking microdaily products, your suite of products, that they had some of the most severe concussions that he's ever seen, and injuries, big breaks. And they are on your product and they're thriving. And it really is, I'm not going to say names, but it's just really remarkable when Dr. Kirk goes, I have never seen such a severe, that's one of the most severe concussive injuries, and they are thriving. They're an author. They're thriving in their life. So that's exciting to us. But what happens when you have continued concussions, you are more susceptible to EMF hypersensitivity. It is one of the risk factors.
Right.
And so we have a 3-year case study, because EMF hypersensitivity is concussion-like symptoms. And that person now lives a high quality life, but he came to us in a wheelchair at 41. So those case studies, but I was thinking about some of today's person that's here that has had TBI, and then they fell at work hard, and they're in their late 60s. And it's really important to be proactive and really take care of your brain now. If you have a healthy brain on here, you need to get after it and do this.
Exactly.
But our brains are fragile, and Dr. Court had them, they're on the nutrients, they have been. thank goodness she was on the nutrients when she fell, because she recovered faster. But this was a big fall. And he had her doing out in the dig on her opposite hand, and and actually rewiring her brain and doing the ABCs and backwards. And she goes, "This is so hard." Her brain was fatiguing. But we wanted to have them in the earth grounding, and they love your products, and they've been on them. And I'm so grateful that she was on those products, because I'm not sure she would have recovered to the level that she has even now. I mean, it's remarkable.
And it's important too, when you have family members or if you have a concussion yourself, to just be gracious when they're struggling. Yes. Because they can go from 0 to overwhelmed like this. Mm-hmm. And that was something that was happening, because, a lot of times I push my clients pretty hard. And today when we were up digging for dinosaurs, and I had her using her non-dominant hand, and I eventually had them actually brushing with both hands to look for dinosaur bones and so forth. And it got a little overwhelming. We had to stop, just take a breath, put our hands in the dirt, and just sit there for a minute and go, it's okay. Yeah. It's okay. When your brain is injured, it takes time. And, even the gummies are a great adjunct. When I look at this suite of products, we have all the products here on the table, I look at the suite of products, I'm like, for a TBI, I can't think of anything that I wouldn't take. And there are some things that I would take more with my brain injury. So for instance, the omegas, I would really pick up. What would you suggest, Dr. Prasad? Here's my thought. For the EMF formula, for a TBI, I would probably do 3 times a day. That's to fine. Really decrease the oxidative stress. Yes. But I would increase the omegas to 2 capsules at least twice, if not 3 times a day.
That again, there is no toxicity involved. We don't know, but it will, if anything, it will cause benefit, not harm. It will not cause harm. I would try twice a day, two capsules in the morning and 2 in the evening.
Right.
If it doesn't show any improvement, then I will do third 2, another 2. But again, even 3 times, as you know, these are all fatty acids. Has no non-toxicity.
So important to the
fatty
inflammation.
Acid repairs the brain so quickly. Mm-hmm. I mean, it's really amazing how fast the brain recovers with fatty
because
acid.
Especially in acute cases like that, I think it's okay to do what you suggested.
And then the gut. We got to remember the gut, because they're not sleeping, and we have to get them sleeping. Yeah. So we have to look at the probiotic for the gut. It's incredibly important in a traumatic
brain.
Important.
Very, very important.
Well, and Dr. Port has worked with young college players that played at high levels and changed their lives. And actually, Dr. Port was invited. He became a pastor, and we were sitting at the front of the table, and we were invited there, and he didn't know that he was there because he changed his life. Yeah. He had a lot of anger because he had a lot of hits. Dr. Port also worked with a Super Bowl champion, and it was a very difficult case that he had, and he was there with the family along the way as a young man that is no longer with us. And so these are very serious.
I know
people on here, and
I'm glad that you guys are doing it.
Well, and as you said, when we're looking at the pro football players, you have to look at, when we look at a pro football player, they didn't just become a pro football player. They had lots and lots and lots of mini concussions because they started out as a 7 or 8 year old, knocking noggins.
Soccer players too.
And they continued to knock noggins, and then went through college, high school, college, then went into the pros, and so they had so many brain injuries prior to even getting there. We're seeing some of the when we do PET scans and things like that on children, we're seeing damage in the brain. So when we have these pro football players, like I spoke to one a few weeks ago, and he's 47, and he's really in serious issues. The heart's giving out, the brain is giving out, the other vital organs are giving out.
But I want to say this, the first thing that Dr. Court recommends when any consult are the nutrients, because we have to have the building blocks. That's the three components of how we heal. And the body doesn't make up a new way to heal. It doesn't matter if it's an injury or an infection. It's, you know, it doesn't make up a new way. And so those building blocks have to be in there so that your body can turn on the genes to heal.
Number one, optimum nutrition.
Number one.
Number one.
Yes.
Number two, work the brain with wakeful activities.
Yes.
And number three, restorative sleep. If we don't get restorative sleep,
perfect,
the game is over. And so those are the things that are all affected with TBI.
Yeah. And all these products that we have, that's why we have multiple approaches that this will help. Not only before you start playing games like kids, but also once you have developed a disease, actually, still it will help you to improve the quality of life.
Well, and there's a reason we call it dis-ease.
Yeah.
I'm going to put someone on the spot right now real quick, because one of those TBIs just popped on the line, and I'm so glad he's here. Kirsten Klug, can you please unmute, my friend?
She had no idea we were going to do this.
She has no idea.
If you don't have Kirsten, Kirsten is one of my heroes.
Hello.
Hi.
You know, I'll tell you why Kirsten is one of my heroes. Because is it okay if I share the story with him a little bit, Kirsten?
Sure, yeah. I just realized I'm seeing your guys' glasses and I'm not seeing my glasses. So I guess I'll just look at you guys blurry. It's okay.
So Kirsten is one of the most amazing people of resilience that I have ever known. So we didn't race together, but we knew a lot of the same people. We raced with a lot of the same people in different parts of the country.
Ski
racing. Kirsten is still a ski racing coach, but she has had some incredible trauma. So Kirsten, would you please just tell us about your trauma that you sustained on the hill? And you can even talk about the other accidents that you had, just in a nutshell. And then tell us how the Micro Daily products have given you your life back.
Okay.
In 30 seconds. No, take a few.
Yeah, in 30 seconds. So yes, I sustained multiple traumas and injuries. I had a car accident where I got in a car accident. That was June of 2017. Then another car accident in January of 2018.
Were they fender benders?
This one was, I was hit from behind and the guy was going about 60 and I was stopped on the freeway. So I slammed forward and hit my head into the steering wheel and like knocked off my headphones for my speaker. And I was wearing a hat. I don't remember much, but anyways, I hit the car in front of me and somehow called 911, like just in a pure, moment. But anyways, and then I was taken to the ER and they like did some x-rays and let me go. That was it. Like they just thought I had banged my head. But I slept for a couple of weeks afterwards and started doing like acupuncture, and I wanted to do like chiropractic care, and acupuncture. So that's what I did. Now I had to have people come to my house because I wouldn't drive. I wouldn't get in a car. I'd go all back roads, all that stuff. And then, but I thought it was fine. And so, ski race coaching is a part of my career. And so I went back up and started coaching again, and I felt fine, coaching and everything. But anyways, I was taking about 30 racers over to a thing, and a guy came and hit me head on straight, as I was skiing, and I wasn't going very fast. So I jumped to the left and he jumped to the right, and I fell and broke my tibial plateau and shattered my shin and had surgery. And then a month later, my physical therapist discovered an infection, said I need to get right in. And it was Friday night. So by Monday morning, I was rushed to the ER and had surgery, and I died. And then I came back to life and realized that if I send love to my leg, and they were about to cut my leg off. So some doctors were figuring about 4 hours till they would cut my leg off. And my doctor, who was a pretty cool guy, was, like, no, she can't, she can bring, she's so strong. So I came back to life, and I just focused on love and sending as much love as I could to my leg. And I had to learn how to walk and talk again because I had lost all of that. So it intensified the head trauma. And then I had 7 surgeries about every 3 to 4 days. And I had a wound vac on the entire time. And I was allergic to most of the antibiotics. And so I started doing research. I'm allergic to sulfites, so I know that. And I'm allergic to Benadryl and penicillin. So I had a specialist that was trying to figure out what would work for me. I figured out by doing research, and I watched my numbers on all the tests that they did every day. And I just kept having them give me all the information. But anyways, I figured out vitamin C was going to save my life. So I told them to put as much vitamin C in me as we could. And then I just really focused on my health and coming back to life. So I was in therapies, speech, because I got aphasia from my brain injury. And
remember,
so I
she was hit at high speed head on the ski run. And so she didn't talk about the concussion. She just talked about the fact that she shattered her leg in multiple places, and then, or it a couple of times when she was there. So tell us about the brain injury and how you and I met.
Yeah, so we met. So I started doing a lot of neurotherapy, neurofeedback. My dog wants to have a say too, because she's my buddy. She helps me out. But anyways, so I was doing neurofeedback. I was doing, I had a neurotherapist. And then I started getting a lot of negative from my partner as well. So that's another hard thing you go through when you have brain injury. But anyways, so then Dr. Court and I met through, I think I was doing Brain Tap, right? Was that the one? Brain Tap. So I was Dr. Porter. I met actually, hold on just a second. My dog's going crazy.
Then we're going to have to wrap this up because we're going to run out of time. But then we did, we put you on the nutrients.
Yes.
And then you had another ski crash. Tell us about that.
Yeah, then I had another ski crash. That would have been about 1.5 years ago. That someone hit me. Mm-hmm. Yeah.
What happened in that crash?
That crash, I was just skiing down before I was setting a course, and someone came out of the woods and landed on me and broke all 3 bones of my ankle, lower leg, same leg. So then I got I have a rod in it. So anyway, so I've been taking the micronutrients since 2020, and it really helped my healing. I really got in touch with how to heal. I've learned a lot about pain, not to stop, just to keep going, but think about all the different muscles. And the micronutrients, I think, are so important because I was also taking CBD, and I was taking Eye Boost and Brain Boost, and I've taken the collagen since it came out. But I was just going to say, overall, I think it's because it reduces your oxidative stress and inflammation. I think that's the most important part, is if we can reduce our inflammation, then we can heal. I have noticed my speech getting much better. And I think that is also because there's less inflammation on the brain. And I had done also eye therapy and brain therapy, where they were trying to rewire kind of all that therapy where you're trying to rewire your brain. But what we found was the injury is so bad in the front that it couldn't get rewired properly with what they were doing, so.
But yeah. I want to say this, you guys, she's gone through a lot of trauma in her life since 2017. But I want you to know she is an author of Healthy Fun Choices. She has a couple books coming out. She's doing work with Dr. Court. She gets to be the ski coach and do all the things that she loves. And I want you to know, without Dr. Prasad's work, even if you've had massive traumatic brain injury, concussions, you can live a quality, vibrant life like Kirsten, because she's an author.
Yes,
okay?
Good
And
example.
books, okay. And so I want for you to be on this call to have hope. And even though it's so much, you're like, wow, that's a lot of trauma. You can heal. We're hardwired to heal. And Dr. Prasad's products, the suite of products, are safe. And I know that all the specials that Kirsten has gone to, it's important that there's no medication contraindications, because she works with many professionals. And this is very important.
Well, it's also important to realize that we've been ski racing since we were little kids. So those were just the latest crashes. This girl and myself have crashed a bunch of times. And that's what's so exciting to me. And watching her from the point when I met her in 2020, just trying to put a sentence together. She didn't make any sense. And now she's making sense. She's working. Kirsten, what do you
That's amazing. That's amazing.
Yeah. I mean, really, truly,
I feel very happy.
What would you like to say to him?
Yeah, thank you for making the product. I think it is so important. And it's just, I want to share it with everyone. And I just feel that it's so important to have. And like I was telling Dr. Court today, I said, some of my best friends and, greatest friends are kind of like, I don't know about it, because there's so many options. And I just say, you got to try it. Like, do you want to be well? And if you want to be well, then do it, give it a try, because it really does change your life. And I love that you've done so much research. And, my dad was a doctor, and, I've really had this passion about starting conversations about whole health and how we can heal. And I just felt like there wasn't enough of that, whether you go to the dental office or the doctor's office. It was just like, they were just addressing what they felt like they needed for you, or when there's just so many things, but they're not getting to the root of it, which I think you really have. Yeah. So I say thank you.
That's right. That's very true.
We all have a story. And Kirsten, I said it before. I've got tears in my eyes. You are a hero of mine. The fact that you continue to get up after these massive injuries, and you continue to put your brain together. You continue to do what it takes, one step at a time. Fall down 7, get up 8. I'm so proud of you. You're a dear friend, and I just know you're going to do tremendous things in this company, because it's in the heart, and you are walking the talk, and you continue to heal. So Dr. Prasad, how does that make you feel?
I think I feel very, very happy, and I cannot imagine that people have this kind of results under that kind of, but moreover, her persistence, she never gave up.
No.
It's also very important for your health.
It reminds me of someone I knew that went to, and gave 17 lectures to the Department of Defense, which means you had 16 no's, and then went to Congress, the House, the Senate, the Judiciary 17 times, and had 16 more no's until finally a yes. And you two have a lot in common. Because you never gave up.
Not giving up. I know. And I'm now teaching yoga too. And I can't fully bend my leg, and, I have the head trauma. So I'll say the wrong words, but, I have really, I think I've come into myself also. And so I think your products have helped with that, because like I had a kind of a yoga guru that's helping me, helping with the apprenticeship. And she was like, well, at some point you're going to be able, whatever she was explaining. I said, you know what, maybe we need to put on there under my title that I have a disabled leg and I have a traumatic brain injury and I am healing. But so anyways, just to let students know that, yes, you can still do stuff, even if you're injured, even if you're in pain, just keep moving forward. But you have days where it's hard, and you just have to learn about that restfulness too,
Yeah, exactly.
I think you need to give all of your yoga clients a little bottle with a hydro in it.
Yeah.
Say,
Oh,
"You need
that's
to do what I do."
yeah.
Well,
Yeah.
we're gonna.
We got to wrap
We
this
do.
baby up.
Well,
We're so glad you popped in.
Thank you, Kirsten.
What a
Thank
great
you. Thank you
pop-in.
very much. Thank you for your story.
Yeah, and
Oh.
Jet and Dr. Court, thank you for inspiring me to keep going and just being there.
Yep.
Thanks for making this call a great call, Kirsten and Dr. Prasad. Thank you for
Thank
being
you.
just you. Go ahead. Let's take it out.
Yes, and get back to the person that put you on this call and let them know you're ready to get started. And if you have had a concussion or TBI or you have some of those symptoms, there is hope.
There is hope.
So get started. And if you want to see a copy of this Optimal Longevity series or any of these series that we've done, you can go onto YouTube, onto Team Serve, and you'll be able to watch them there. But if you want to unmute, we can go ahead and thank Dr. Prasad for his incredible, I don't even know, his body of work and the lives he's changed. You can go ahead and unmute and say thanks.
The living
Thank
legend.
Thank you, Dr. Prasad.
Thank
Thank you,
you,
Dr.
Dr. Prasad.
Thank
Thank
you.
you.
Dr. Prasad.
Have a good night.
Everyone have a good night. Thank
Dr.
you.
Court.
Thanks,
Thank you,
everybody.
everyone.
Thank
Thank you,
you.
Dr. Prasad.
Thank you.
Thank you,
Thank you.
Kirsten.
Thank you.
Have a good night, everyone.
Have a
Good
great
night,
night.
everyone.
Be well.
Bye-bye.
Bye-bye.
Bye.